To learn about the naturopathic approach to the treatment of diabetes, we talk with Dr. Lena Kian, but began by meeting her patient, Bill Green, who explains that conventional treatments only got him so far.
Well, about 2.5 years ago, I started feeling really fatigued, and my vision actually started getting quite a bit blurred. So I didn't know what was going on, and I went down to the local pharmacy, bought a test kit, a diabetes test kit, and my wife suggested I do that. So I tried that out, and it was really high. So went to my doctor, and they diagnosed me as type 2 diabetes. And after that, they put me on the medications, and it came down quite a bit and kept coming down, and it got to a plateau where it about stopped and wouldn't come down anymore. And the medications, I wasn't feeling too good and stuff with them, and I didn't want to increase them to bring it down where it should be. So we thought, well, let's try that. We've heard stuff about natural medicine. So we ended up going to her and having some good visits, and she put me on some medicines or some natural products. And actually the diabetes came down quite a bit more, and it's real close to the levels I want to get to without going to the medications from the doctor, increasing them. And overall, I started feeling better, and the stuff I was taking from her, my energy levels went up, and I wasn't taking naps every day, and feeling a lot better, and I have been, and the points of the diabetes came down good too, so real happy on all that. I went in there, I was a little worried because on the door it was women's doctors on the door, so I was kind of nervous about it, and I went in there and she was real easy to talk to, and real pleasant, and questions, she answered everything. So I was wondering the difference between two doctors. I've never been to a natural doctor before, so she answered everything to my satisfaction and above, so real happy. The doctor I have is real good too, out of Loma Linda, so I'm real happy with him. But she was a bonus above that. It's something like icing on the cake. So I'm still taking my normal medication, but I didn't have to increase it all or anything. If anything, I've brought it down to level, and taking her natural stuff, I've stayed the same. So real happy.
We asked Dr. Kian the importance of family history.
Just as important as it is to know your family history, it's also important to know that your lifestyle and your environment play just as significant, if anything more, of a role in determining the state of your health. So diabetes is a lifestyle imbalance. If you're abiding by eating a whole foods, low glycemic diet, if you're exercising and being physically active, if you're engaged and feeling very connected to your environment, then you're less likely to become diabetic.
I get up in the morning, and every day almost about 1 or 2 o'clock I'd want to take a nap, and now I go through the whole day no problem, and stand with her stuff that she prescribed to me, and real happy.
He feels great. He's lost weight. He feels, and that's what's interesting is when you change your diet and you eat a whole foods-based diet, you want to keep doing that because it feels so good, and you can't imagine eating anything else. So he feels great.
And my doctor, he even said, I get the way I'm going, and he says maybe in the next year or so I might even be off the medications the way it's going, and that's my goal, is to get off his medications and stay on hers. So that's my goal, because that stuff isn't good for you, what the doctor prescribes.
It's very important to identify and to treat the cause of health problems, and that's an analogy that I give to my patients is if your car's check engine light is on, the point isn't to cut the wire that's connected to the check engine light, but to actually open the hood and to go inside and look at the engine. And what one problem might be that leads to the car's light being on in the engine might be completely different than another car. So the point is to look beyond symptoms, to look at the root of the problem, and to identify that.